As an innovative public servant and the longest-serving Commissioner of Health in Lagos State, Dr. Olajide Idris has significantly upgraded the Lagos State health system through a comprehensive health sector reform agenda. His accomplishments include the establishment of 578 tuberculosis treatment centers, making Lagos the state with the highest number of directly observed treatment or DOT centers in Nigeria. Under his leadership, significant work has been done to transform the primary healthcare system in Lagos State, improving the access to basic healthcare. He has also successfully put in place the Health Planning Unit, which collates data from all possible sources to help the state analyze, project, and plan for the health of its residents. The establishment of a vibrant state health insurance scheme under his watch has made Lagos one of the forerunner states in the quest for universal health coverage in Nigeria. Nigeria Health Watch spoke to a few colleagues in the health sector to learn what they had to say about this transformational agent.
Dr. Idris is an exemplary public servant, somebody that is hardworking, diligent, very professional. He's a collaborator, someone that believes in strategic partnerships with everybody. He's an advocate for the public-private partnerships. He's somebody that believes that the healthcare sector cannot be done by only government.
I think one of the biggest contributors to Dr. Jide Idris' success at the highest level of public administration is preparedness. So you see someone whose pedigree from secondary school, King's College, University of Lagos, he's been well prepared for the rigors, the intellectual rigors that need to go into planning and policy issues at the highest level. Him being a veteran of having been a PAMSEC himself, he came prepared for the position of Commissioner of Health, very effectively. He has served, and then he has now ascended to the position of policy making.
The first is dedication to service. For Dr. Jide, in most instances, you will see that he's sort of just fighting sometimes for compliance or doing everything he can to make sure that at least the interest of the people is protected.
He has the courage of his convictions. He's someone who follows through with his beliefs, something he believes in, something he's passionate about, something he thinks has usefulness to it. And he follows through irrespective of criticism or concerns, as long as he's listening to everybody, and he does listen.
He has an unusual doggedness to issue, is committed to health system reforms, and has exceptional leadership skills.
He knows what he wants, and he goes for it. He's so passionate that he gets personally involved in the detail of what he's trying to accomplish.
Sheer consistency, persistence, stickability. I'm trying to describe whatever it is that has made him focus on healthcare in Lagos State for literally decades. That has meant that he has been able to amass the necessary experience, store up institutional memory, and discharge his duties in terms of steering the healthcare developments in Lagos State with great expertise, because he has so much experience, not just in the public health side, but of course in the intricacies of governing in the health sector in Lagos State.
A man's greatest achievements is what he's able to achieve when he's on world stage, when the eyes of the world are on him. And so you can do many other things well, right? At local level. But when you get to that world stage, how do you deliver? Ebola put Nigeria on the world stage, and it could have gone very badly. The legacy of the Jide Idris steering of the helms of health affairs in Lagos will be how well the states, in collaboration with other agencies like the federal establishments and the Federal Ministry of Health, countered Ebola and prevented it from being the disaster that it easily could have been.
He has quite a number of achievements, okay? One, I would start with he's being able to manage the Ebola crisis, because I know that if Dr. Idris did not intervene and manage that process the way he did, Nigeria will be a totally different country now as we speak.
The greatest is the fact that it was the Commissioner of Health of Lagos State when Ebola broke in that state. And the fact that the Lagos State's effort was evident, so to the point that they got awarded for it around the world, recognized for it around the world. It means a lot that I feel forever, since the history of Ebola will not quickly run away from public health, records will always go back to the fact that Lagos was strategic. It wasn't just a Nigeria's response. The Lagos presence was particularly important for the country.
Dr. Idris has achieved a lot in his various tenures as the Honorable Commissioner of Health of Lagos State. There are various things I could say. Most of you would probably say Ebola, but I would think that it is healthcare reform, something that's been transformational, that impacts the lives of every Lagosian. This law that he was able to make healthcare insurance mandatory is transformational. Not only is it the law that everybody that could possibly get sick now have access to quality healthcare, but he has made sure that beyond the law, it becomes implementable.
Longevity of Dr. Idris's tenure as Commissioner of Health is something that is associated with a mix of innovation and transformational health reforms. And I will break that into three parts. First is the implementation of the Lagos health sector reforms. Second will be the implementation of the Lagos State Health Management Agency. Third will be the innovative reforms around private sector participation in health.
I think what is going to make the real long-lasting difference is going to be his attention to the Lagos State Health Insurance Scheme and the establishment of primary health care, which is really the building block, the sort of base for establishing a functional healthcare system and universal health coverage.
His greatest achievement, well, I think the most obvious one, because it's the most dramatic, would have to be how Lagos State coped with the Ebola outbreak. What I think will go down, however, as his greatest achievement is yet to have its full impact, but we will see it, I'm sure, very soon coming down, coming to fruition in the next few months and years, and that is the implementation of health insurance, mandatory health insurance in Lagos State. One of the key steps in achieving improvements and development in the health sector across the nation is going to be health insurance. Lagos State, as usual, is ahead of the game. They passed their legislation, I think 2 years ago, one of the first states in the nation to pass legislation to implement mandatory health insurance in the state, and they're following that up with full implementation as we speak. And I think that's going to revolutionize healthcare in Lagos State, and Dr. Olajide Idris, quite rightly, will get a lot of the plaudits for that particular project.
He has set quite a number of examples that other, states need to emulate. So I would, just pretty much summarize it in the sense that Dr. Idris, with all his reforms, which is really why he has stayed so long in office, the fact that he is implementing quite a number of dynamic and innovative solutions just to improve the quality of healthcare in Lagos State.
So his healthcare reforms in terms of human resources for healthcare, in terms of financing for healthcare, and in terms of making sure that he can change the infrastructure in Lagos State is a significant transformational agenda that he's been able to achieve.